Hello, this is Dr. Gay from First Look MRI, and this is a 59-year-old male who had pain and swelling after a really minor injury of their hand. They have lots of swelling and pain over the knuckles here, and it looks kind of like an injury you'd expect if you punch something, like a boxer's type injury, but they did not have that mechanism. They had some swiping motion where they got their finger stuck, I guess, and have this swelling and pain. So as we look at this, we see lots of edema over the extensor tendons surrounding them, and the extensor tendons look good. This is the extensor tendon of the fourth, fifth, third, second. Looks like they are all intact, so there's no tendon rupture, which is great. The bones, muscles look within normal limits. Flexor tendons also looked intact. And so let's put up an axial coronal T1 weighted sequence. So on this coronal T1 weighted sequence, we can see the fourth extensor tendon coming across here into the digit. We see the third one. The third one looks like it's deviated, though, in an ulnar direction. Here's the radial side, the thumb, and if you see this third one, it does not go straight across the knuckle. It's deviated, and there's some gray tissue over here. We'll see that in a second. And here's the index finger, second tendon, looking pretty good. So we're going to look at this over here in short axis. So in the short axis, we're going to start over here on the fourth. Here's the fifth, fourth, third. So the fourth extensor tendon, this is a central slip of the fourth extensor tendon here, and we see part of the extensor mechanism. It comes up over here, this little linear band. This is part of the sagittal band. This is the ulnar aspect of the sagittal band, and it goes over the top and bottom, invests or surrounds the extensor tendon, and it also goes along the radial side. So this sagittal band is intact. And it holds the fourth extensor tendon right in normal position, really close and hugging the fourth metacarpal head here. But if we go over here to the third extensor tendon, I'll slide this on over here to see a little bit better. We see that things are not so good. We see lots of intermediate signal intensity here, and we're looking for that sagittal band. We just don't see it. So we should see a nice thin band coming across here, investing this, holding this centrally about right here, but instead it is absent. So this is a ruptured sagittal band. The radial sagittal band is ruptured, and it allows this to drift medially. Now I don't see the ulnar sagittal band either. That may also be ruptured, but this is a ruptured sagittal band, and this will allow the tendon to slip. Usually it's along the radial aspect of the third or fourth. This is often seen with boxers. They call it a boxer's knuckle. And you can also see it in people who have rheumatoid arthritis. They get weakening and they can tear. And in this case, they were not a boxer. And I do not believe they had any history of rheumatoid arthritis. And I'll just put up another quick little view here from the sagittal stir sequence. See all that soft tissue swelling edema. There's that extensor tendon that's intact, but just deviated. This must be part of that extensor mechanism that's torn. Part of that sagittal band is torn and uplifted and looks kind of frayed there. And that's it. Thank you very much.